UNICEF has been called upon to deliver an emergency response in not the very sort of traditional underdevelopment type of situation like a South Sudan, as we see in some contexts. So Lebanon is an example of where UNICEF is active in an upper middle income country or a middle income country and being asked to provide a massive emergency response in that context. So that is the question that is a changing context. You know, we unfortunately continue to have very traditional sort of emergencies. Once again, coming back to the example of South Sudan, where there's very little infrastructure, very little capacity, horrible crimes, needs that are being put into effect, and how does UNICEF deliver that response in that very difficult environment? But then how are we remaining an organization too who can also deliver similar commitments, similar abilities, but in a different mechanism in an upper middle income country? Well, I think in Lebanon we have the example of when the refugees initially came over in 2013, we really responded in a very sort of somewhat traditional manner. We set up supports through sort of mobile situations, so in health, mobile clinics, and in education, in tents, and child protection, and child-friendly spaces, and we really delivered a response through our traditional emergency mechanisms, us and all the big international NGOs who arrived at the same time. As time moved on, the emergency has become chronic, unfortunately, but also the way we've responded to it has been more thought out, saying, well, if we're really going to provide education, it's not a few months in a tent that's going to do some literacy program that's going to work. How do you provide children education over the long term, let's say minimum 5 to 10 years? So how do you actually deliver the same type of service, be it health, education, child protection, at scale for a massive amounts of population, where you are sustainably providing support to a system and building that system so that not only do you deliver better results, but something is left behind for the country. We would never be able to deliver that kind of response through the old mechanisms of NGO partnerships delivering at that kind of scale. So we had to go massively to the government to be able to do it, but not uniquely to the government, because there is a very strong rule that remains for NGOs, both international and national, in terms of providing quality supports, but also very specialized services that the government in Lebanon in particular was not able to provide. So there's sort of a two-track. Support the government to build their system, strengthen it, deliver at scale a service, but continue to work with more and more local NGOs to be able to provide a higher quality services, specialized support, follow-up. So very concretely in education, the ministry sends the kids to school, the NGOs do homework support, out-of-school support, the psychosocial. So all these packages go together to deliver a response, which is a very different response from the initial one, which was traditional, put a kid in a tent with an NGO providing sort of a couple months of a curriculum on basic literacy and numeracy. What we've done here that you haven't seen in other areas is we are the first, I think, emergency to have done design from scratch an unconditional cash transfer system to incentivize children to not go to child labor and spend more time in school. So with other partners, it's also the first time that we've literally paired ourselves with UNHCR, WFP, and 6 NGOs to deliver all those services through one ATM card, debit card, that can be used across the board. So it's the first time that you see so many actors working in unison on one project. Another big area of innovation that Lebanon has worked on, and I think we are sort of on the cutting edge, is we've really tried, us and Jordan and a few other countries who are working in the Syria crisis, we are one of the first countries who are really sort of trying to push the envelope when it comes to UNICEF on what is our role when it comes to technical and vocational training, and youth, how we program for youth in the non-traditional way and really get people to be able to have better skills, better entrepreneurship skills, better innovation skills, digital skills. We're doing this across the board and at scale. So we're really entering into a new area where UNICEF traditionally has not sought to act or take leadership at scale in an emergency. So the first one is that we were slow to shift from what would be a traditional emergency response in a refugee crisis type of situation. So we went in with our major international partners and the NGOs who arrived at the same time, and we provided sort of very traditional, what I would call traditional emergency response. So that was, if we were providing health, it was with medical units, mobile units, through different outreach programs. If we were providing some sort of education initiative, it was through international NGOs, providing sort of basic literacy and numeracy in a tented type of situations with a tent and a sort of, some kind of teaching methodology. But that wasn't even harmonized across all the NGOs. And we quickly saw, as the crisis went on and became chronic, that we couldn't sustain that. It was not necessarily the most efficient, and it wasn't also the best for the emergency. I mean, we had 12 different curriculums in education being applied, not necessarily adapted to the local context, not necessarily approved by the Ministry of Education. So you transition from that to what we have now, which is building systems, all the kids going through a public education system, delivering consistent education that we hope for 5 to 10 years. So completely separate type of situation. The mistake is, couldn't have we been much faster to make that transition? It took us a couple of years here in Lebanon, and that should not be the case. When we look at upper middle income countries or middle income countries with this type of emergency, we should think of how do we achieve scale and efficiencies and system build, all three of those things simultaneously in that country. And the logical response doesn't necessarily have to be the same way of through the large international NGO partnerships delivering that kind of service. The large NGO partnerships have a very clear role to play, but it may not be the traditional ones. It took us a long time, but once we got there, we are delivering a sort of a new methodology of how you deliver emergency response at scale. So we're doing it through government counterparts, building the systems at the same time as delivering an emergency response, in this case for a refugee population. That would be one strong lesson learned. I think also because of the context and how much liberty we've been given in Lebanon, we have been able to test out new innovation pilots. Or 2 or 3 of them. So to mention some, we are one of the first countries actually trying to apply a non-conditional cash transfer to children to try and incentivize them to stay longer in school, but also not resort to negative coping mechanisms like child labor. Not only is it innovative in terms of it's something that you see typically in development, but we're applying it for the emergency response. There is no continuum. Development is going on at the same time as the emergency, and how we do them together is a critical point. It's not when do we do one and stop. So I think, once again, if we had been more conscientious of that in the beginning of this emergency and taken that route initially, maybe we would have been more effective. So, but this is a classic situation of an office that had 15 people, was fully in development, technical support to government of an upper middle income country, who was then hit with a massive emergency. And how they delivered it was to rely on UNICEF coming in and delivering their typical response, rather than saying, okay, wait, this is a different context. How do we deliver? We're down a journey, but we still have a long way to go. So how do we make that more efficient? How, with also ensuring quality of services. We've been a lot, as most in emergencies, sometimes thinking about the number of children we reach. Now we have to really make sure that the outcomes are there for what we're trying to provide. So in education, it's, as we know, it's not just about getting the kids into school, it's what they're learning and then being able to measure that. So unfortunately, you need to do that in probably a new reality where we can't assume the amount of funding that we've had in the past. So how do we reach a new level, provide better efficiency, better quality, but also take into account the risk of decreasing funding in years to come. So those are sort of the issues that we will be confronted with. And so all the more incentive for us to do it through national systems, all the more incentives for us to do it through national NGOs, which are more efficient, more cost effective, and would allow us to meet those sort of financial benchmarks at the same way. Sometimes in a situation like this one, and the amount of attention that's given to this emergency, there are opportunities, and sometimes time and resources do not allow us to take all those opportunities into account. So I think some of those questions would be the ones that I put. I think we could be more forward thinking of how we could do further cross-border work for Syria, for the return, start to thinking of those systems going forward already.